Heart and circulatory disease is Britain's biggest killer. Over 250,000 people lose their lives to it every year in Britain. But it's not just middle-aged men that are affected. Everyone is at risk. Heart disease causes about 40% of all deaths. That's over 245,000 people annually. Every year, 50,000 more women die from heart disease than from cancer.
About 2 years ago, I had my first heart attack. I was with friends in a cafe, drinking a coffee. Suddenly I felt it's like a burning sensation in my chest. And then 2 months ago, I had another one. Again, out of the blue. It was a bit more aggressive, this one, than the last one. I was walking down the street, just felt suddenly a bit tired. So they rushed me into surgery, and I was gone. I had to defibrillate me, shock me back to life.
Around half of all heart attacks are fatal. If you do survive, your life is unlikely to be the same ever again. You may suffer chronic pain. You'll almost certainly be on medication for the rest of your life. Simple things like walking upstairs will be very difficult. Your heart pumps blood around your body. The muscle contracts about 70 times a minute for the whole of your life. To do this, it needs its own blood supply from the coronary arteries. Fatty deposits can build up in your coronary arteries. Blood clots can block them completely, especially if they're already narrowed by fat. When an artery is blocked, the heart muscle doesn't get the oxygen that it needs. Some of the muscle starts to die. The person has a heart attack. If you're having a heart attack, you'll probably start to sweat. You'll feel lightheaded. Breathing may be harder work than usual. You may feel sick, and you'll almost certainly experience pain in your chest. You can't catch heart disease. It's not normally caused by an infection. What can you do to reduce your risk of having a heart attack?
Lifestyle, things like smoking, the level of exercise that you do, how much you eat, what you eat, whether you're overweight or not, and of course whether you smoke. And they're probably the principal determinant of whether you're going to run into trouble later in life.
Smoking, heavy drinking, physical inactivity, a high-fat diet and certain kinds of stress are all risk factors for coronary heart disease.
Right, Barry, it's about 2 months.
Barry only drank moderately and he coped well with stress, but he smoked, didn't exercise much and was slightly overweight. These risk factors, plus a family history of coronary heart disease, added up to 2 heart attacks by the time he was 35.
Even when I was having the heart attack, it was like, when they came to me in the hospital and said, look, you're having a heart attack, I was like, don't be stupid. You expect it not to happen to you. You don't expect it.
That we experience people having heart attacks at very young ages. We are seeing increasing numbers of young people in their 30s and 40s and sometimes even 20s with heart attacks.
If you could see the future as a teenager, I might have done things a bit differently and I might have avoided things. It's kind of like I was driving my Mercedes-Benz with no oil in first gear, without a care in the world, and now I've had a major service and they tell me it's okay, but, I've still got to take it easy, I've still got to take my pills, and, I'm going to be on medication for the rest of my life, for sure.
What we've got here is Barry's angiogram, and an angiogram is one of the key tests that heart doctors use when they're investigating heart disease. And looking at this angiogram, which is Barry's taken when he had his heart attack, we can see that here there's an abrupt blockage in his artery, and this picture was taken when Barry's heart attack happened. And you can see that after a balloon treatment has been performed on this artery, the artery is now wide open and blood is flowing normally down.